because it is a major source of preterm delivery, and it's a major source that's associated with maternal morbidity.
Every year, a somewhat common but very serious pregnancy complication can lead to potentially deadly outcomes for moms and babies. And it is a leading cause of maternal and infant illness and death. About 60% of cases, though, can be preventable. So we are talking this month about preeclampsia in Preeclampsia, ooh, that's a mouthful, Awareness Month. We have today Dr. Abby Barnes with me from HCA Health One. Thanks for being here. And I know you're a little bit without a voice today.
I know, I apologize.
You sound great. You sound great. We're going to power through. I think a lot of people who have never gone through pregnancy or had a complication like this don't even know really what preeclampsia means. We hear that word. We hear about high blood pressure. What is that exactly? What's going on?
Yeah, so preeclampsia is a spectrum disease of high blood pressure in pregnancy. It typically occurs in the later trimesters and can lead to problems with the kidneys, the liver, and blood cells like platelets. And in its most severe forms can lead to seizure or stroke.
Okay. I know during my pregnancy, I had my blood checked, my blood pressure checked every appointment I was there. Is that how you're monitoring, trying to catch this among other problems? How do you catch it? What are the signs and symptoms?
Yeah, so we don't have a blood screening test for preeclampsia. So we monitor your blood pressure at every prenatal visit. And then if someone has risk factors or their blood pressures are starting to increase, then we have blood tests that we can do to monitor their kidney and liver function.
And what are some of those other risk factors besides just your blood pressure?
Yeah, so patients who are older, very young, or those who have other health conditions before pregnancy, such as diabetes, kidney disease, and pre-existing high blood pressure.
I see. Is this something, you talk about it being late in pregnancy, are a lot of women showing up in their final appointments or even at delivery and finding this out? Is that how that often presents?
So it can present any time in that late second to third trimester. I would say more often we see it in the later third trimester, but sometimes it can show itself postpartum, after delivery even.
Interesting. I got lucky that I didn't have to deal with this complication, but I've had girlfriends who did, and almost all of them delivered early. What do you do once you know a patient has preeclampsia?
Yeah, so if you were diagnosed with preeclampsia without severe complications, then we recommend delivery at 37 weeks or when you're diagnosed after that point.
I see. Okay.
And that is to help to reduce the risk to moms. And we know babies are well developed at that point, so they tend to do very well after delivery.
And at 37, I mean, you're full term. The baby's fully cooked, right?
Correct.
So really, you're just trying to end the complications earlier, right? Just be done with the pregnancy at that point, okay? If you are a woman who's going through this process, is there questions you should be asking or notifying your doctor, like, I'm worried about this? Or is it kind of just one of those wait and see things in pregnancy? We'll get along as we go and monitor, we'll find out.
You know, it's a little of both, you know, because as I said, we'll monitor your blood pressure. Not everyone has symptoms of preeclampsia as it's developing, but we tell all of our patients to call if you have a headache that doesn't get better with medication, persistent stars or spots in your vision, new chest pain, shortness of breath, or pain in the right side. And then we do talk with all of our patients at their early prenatal visits about whether or not taking aspirin starting around 12 weeks of pregnancy is a good tool for them to help prevent or reduce the severity of preeclampsia.
Interesting, okay. And this is not uncommon, right? I mean, I know people in my life who've dealt with this. I don't know if we would call it super common, but not uncommon, right?
Yeah, it's about 1 in 25 pregnancies, so it's a very common condition. And like I said, it's a spectrum, so not everyone has the very severe form.
Okay, all right. Well, thanks for coming in today, talking us through it. Interesting to have like these awareness, you know, months, if you will, but babies are being born all the time. So this is something you're dealing with 12 months out of the year.
Thank you for having me.
Thank you. We will